terms of what is going on with adolescents and these 5 protective factors. And then the last class is a class that's called Families Thrive, and it really has combined the strength in the families, which is the early, with the adolescents, which is the youth going through emerging adulthood. It's put those together and come up with another class, which once again, these 5 protective factors. So I am a trained facilitator in all of those classes. They come out of the Center for the Study of Social Policy. And once again, they are all really powerful, just depending on kind of the audience that you want to really reach and teach to at that particular point. So in terms of our agenda, once again, welcome. We're going to talk about our learning objectives. We're going to talk about the definition of important terms, because I think that is always something that, to kind of get on the same playing field. We're going to really talk about this adverse childhood experiences study. Some of you may know about it. It's critical because that really is kind of the basis in terms of why it is we bring the importance of these protective factors forward. And then we're going to talk about what is the impact of trauma, toxic stress, and these adverse childhood experiences in terms of how does it affect our children as they develop. And then we're going to, once again, at a high level, I'm just going to tell you what these 5 protective factors are and where you can go and gain some additional information. So our learning objectives, and I'm talking kind of fast because once again, there's lots of information. Okay, this session, is my understanding, is being recorded, so you can always go back and listen to it again. By the end of this session, you will be able to understand and define trauma, toxic stress, and adverse childhood experiences. You'll know what went on within the context of that study and have a very good idea when someone talks to you about it. You'll know enough that you can have that conversation and the importance of it. If you'd like to, I can send you your own ACES survey or calculating your ACES score. At the end of this, I'm going to give you my contact information. All you need to do is to send me an email, and I will make sure that you get a copy of it. We're going to talk about what is the link between those adverse childhood experiences, trauma, toxic stress, and once again, these strengthening families protective factors, which are really going to be talking about their mitigators to all of these adverse experiences that can happen to us as children. And then we're going to talk about describing the strengthening families protective and promotive factors. So there's some group agreements that I always kind of like to talk about before we start, and because I think these kind of lay the groundwork in terms of when we listen to these conversations and hopefully the way that you will bring yourself to the table. So we talk about listen to learn versus to answer. I am always a person that understands that when I go to a session, I'm not there to try to figure out, do I know the answer to the question? It's what is it that I can learn? There's something new that I can fit into this piece of the puzzle for all those other things that I already know. I want you to hopefully be willing to try on some new and some different concepts. Some of that may come out of this. It may or may not, but just be open to that. Sometimes when we do that, we have to challenge what our old ideas and behaviors with kindness. We knew those things at the time. We thought that they were right. Perhaps they were not, but now it's time for perhaps a new day, a new way of thinking, a new way of acting, a new way of really bringing ourselves to the table. I want this to be a safe environment for sharing, reflecting, and peer learning. When I do this class in person, or when I do it, in a different way, that as opposed to just presenting to you today, which is really kind of what I'm going to be doing, it is a very interactive class. So that really applies to that scenario. I want you to be willing to step out of your comfort zone and to be able to lean into discomfort. There may be some things here that kind of don't fit in with what you normally do, the way that you normally do it, or thoughts that you've had about this piece of work and how it is we do this work. We want you to be able to ask questions for clarification. So if in fact you have questions, you can put them in the Q&A. I'm not going to be monitoring that until the end of the session. I always talk about that I need you to take care of your own needs, whatever that means in terms of we're going to be spending the next 2 hours together. If that means you need to stand up, if you need to go off screen, if you hear something that makes you uncomfortable or something that you think I can't deal with right about now, I need you to figure out, what does safety look for you? Emotional safety, physical safety, spiritual safety, all those pieces of safety. I need you to make sure that at all points throughout this presentation that you are in a safe zone. And if not, I need you to figure out what it is you need to do to put yourself there, because your safety is the most important thing that happens as we progress throughout this, sharing this information. And I always talk about the fact that when we have these classes, I need them to be a judgment-free zone, because when you bring judgment to the table, that means you're already not necessarily listening or hearing and being open to new and different ways of thinking and information. So once again, these are the group agreements that I normally propose when I do my class, and I'm proposing that we use them now. So we're going to start with our first topic. We're going to talk about what? Adverse childhood experiences, trauma, and toxic stress. So there are some key messages. Hold on just one second. I'm trying to get this off of my top. Hold on. Okay. Hold on. Great. 1 second. Just bear with me. Okay. So these are what I call Maria's key messages. And these are things that are important to me as I go about sharing this body of work with you. So, and even as I go about doing this work, for the most part, I am a trainer and a facilitator. I'm not a person that actually goes one-on-one and deals with families, but okay, hold on just a second. Okay. But lots of things, but one of the things I have learned more than anything is when we talk about the families are the experts on their own family. Can everyone see my screen? Hold on just a second. Okay, I'm not sure what's happened. Chris?
Can you try to share it again?
Okay, hold on just a second. So do I just hit escape? Okay, how do I get into, hold on just a second. Okay, so how do I share my screen? Because I don't see it anywhere on here. I just see the Zoom meeting. Oh, I see share screen. Okay, got it. Okay. Okay,
There you go.
perfect.
Thank you.
Oh, you're welcome. Okay, so we talk about the families are the experts on their own families. So one of the things I know that I always talk about, sometimes we feel like we're in the fix-it business, that we always know better for families than they know for themselves. We do not. We need to understand and honor that people know themselves and their families better than anyone. And we need to figure out how it is that we can partner with them to gain that knowledge, to be really partnerships and whatever it is that we're bringing to the table, whatever that product or service, or how it is we even bring ourselves to the table. I talk about the fact that families are not broken. We use that term so often. And they are not broken, and it's not our job to fix them. The only person you can fix is you. What it is, I think our job is what? To increase the capabilities and the capacities of the families that we serve so that they will be better parents, better caregivers, and better just people. I talk about the fact that each family is distinct and unique and has their own story and culture. That is so important that we understand what the story of the family looks like and feels like. What does that culture look like and feel like? And based on that, how it is that we need to make sure that, once again, how we bring ourselves to the table, those products and services, are they culturally appropriate? Are they something that this family is going to think is important? Is it going to be a priority with this family? What has happened to this family to even bring them to the point where we are involved with them and we're having this relationship in terms of some sort of product or service that we're bringing to them? So we need to really, once again, and you establish that by establishing trust with the family when they feel like they can really let you know what's going on with them and what the story and the history and the culture of that family is. I talk about the fact that this is strength based. Everything that I talk about and do, no matter, I teach lots and lots of classes, all of them come from the perspective of we need to be strength based, which means what? We are not looking for what families are doing wrong, because it's always easy to tell somebody you're doing this, and this incorrectly. But we need to be looking for the things that our families that are doing that are correct. And based on that, how is that we can really, use those things to launch a relationship, to really to enhance a relationship? How is it that we can use those good things to make them feel good about themselves? Because sometimes families have never heard, you're doing good, this, and this. All they ever hear is that you're not doing this right, you're not doing the right. We need to have a different perspective. And those protective factors talk about we come from a strength based perspective. Let's try to find the things that our families are doing right, capitalize off of those, enhance those in terms of hoping to build, once again, a relationship. I'm going to talk about over and over again that relationship that you have with the families that you serve. That is the most powerful thing that you can bring to the table, because everything happens as a result of those relationships. And we talk about what? The strengthening families protective factors focuses on strengthening infant, child, youth, family, and community well-being, and provides tools for all families to thrive. And even though specifically it looks at the child age from 0 to 5, really, but when you talk about increasing the capabilities of caregivers, whether it's from 0 to 5 or whatever, those protective factors, the skills that you teach them, they will use across the lifespan, and they can use these same protective factors with their other children. They may be modified a little bit, they may look a little bit differently, but basically they're going to be kind of the same skill set with some modifications. So this is really one of the quotes. I love James Baldwin, and he has. This is one of his most famous quotes. And to me, when we talk about adversity, when we talk about trauma, when we talk about toxic stress, when we talk about all those things, this hits home with me. What does it say? It says, "People are trapped in history, and history is trapped in them." So the way that he explains this, he says, "The great force of history comes from the fact that we carry it within us, are unconsciously controlled by it in many ways, and history is literally present in all that we do." So when we think about history, when we think about trauma, we need to think about what are all these ways, or what are all the historical things that could happen to us in terms of different types of trauma. So we think about there's historical trauma, there could be cultural trauma, there can be intergenerational trauma, there can be personal trauma, there can be community trauma, and all of that trauma impacts us. All of it, you're going to hear everybody kind of, there's this whole notion that what? Trauma gets under our skin and lives within us. So don't think just because you know you have a history and I don't know my history, you need to find out your history, because your history is a part of who you are. Is it a part of your DNA, whether you know it or not? History is a part of the way we are, the way we see the world, and the way that, once again, we are physically, mentally, and emotionally constructed. Powerful quote. Okay, so one of the things that the whole Strength in the Family's Protective Factors framework really talks a lot about, it really talks about this whole idea of how it is that we can really, increase what they call the capacities and the capabilities of the adults. Because yes, we can certainly bring products and services to say we're going to focus on this kid, we're going to do all these things for the child, but unless, once again, we can increase the capacities and capabilities of the adults. If we don't give them the skills and the knowledge and the tools that they need, nothing will change. You will do all these things for this kid, send this child back to a home where you have the same set of parents. So we're going to look at this little 5-minute video. It is so powerful, and I want you to know this comes from the Center for the Developing Child by the Harvard University. They have a website. They have so many, I love them. They have so many free products and things that you can take advantage of, and this is just one of the snippets. So I'm going to play this. Listen carefully when it talks about building adult capacities, and the bottom line is to improve child outcomes.
The social challenges that face modern societies, whether it's the ability to work productively, to be a good citizen, stay healthy, have their roots in early health and development. A strong foundation in early childhood results in much better and more effective development later. A weak foundation really puts us behind. The most important thing children need to thrive is to live in an environment of relationships that begins in their family, but also extends out to adults who are family members in childcare centers, other programs. What children need is that entire environment of relationships to be invested in their healthy development. We've shown from decades of testing interventions that we can improve outcomes. But the magnitude of those impacts is not good enough. Science is now available to help us think about what we might do that would have a bigger impact than the best of what we've done before. So we began to ask, what could we be doing differently? What could we do to be smarter? Children who are at the greatest risk for the poorest outcomes in learning and health and behavior, children who experience a pile, a cumulative burden of one after another on the development of the adults. What could we be doing to strengthen the capacity of everyone who interacts with children? This led us to think about the kinds of skills you need to deal with adversity, these skills of focusing attention, planning, monitoring, delaying gratification, being able to solve problems, being able to work in teams, executive function, and self-regulation. They're also the kind of skills you need to create a well-regulated home and school environment in which healthy development and learning can take place. Science started to tell us that differences in those skills start to develop in infancy based on the environment kids live in. So, how do those skills develop? Well, if you don't develop them early, how do you develop them later? Actually, you can build them later because the period of flexibility and plasticity for this part of the brain doesn't fully mature until age 25 to 30. And then the light bulb went on. The reason we're not getting a bigger impact know about how to influence development, but because we're giving information and advice to people who we need to do active skill building with. Skill building by coaching, by training, by practice, but we're not doing that. So we now have developed this theory of change that says we need to focus on the development of the adults who are important in kids' lives.
So try this. How does that work? That's a new idea. Buen trabajo.
We need to focus on their skills, their needs, in order for them to be better, more effective parents, in order for them to be better prepared to be employable, which would enhance the economic stability of the family, which is also good for children. Second of all, we looked at many people in preschool programs and child care centers. And we said, what are we doing to build those skills in the providers? They need skill building as well. And also the community can help to build and reinforce the capacities that parents need. And the community also includes programs in which the people who work in the programs have sufficient skills. Third of all, what are the major sources of toxic stress in this community and how can we reduce them? Moving it up to a policy level, policies strengthening communities' abilities to reduce source of toxic stress and caregivers' abilities to provide what kids need. The development of our human capital is our future. The development of a productive workforce is our future. The development of a healthy population is our future. This kind of future orientation is critical for healthy society. It's critical for a thriving business. It's critical for successful environment and relationships to raise children. It's all about being able to plan for the future, to have a future. And that's why this is so important.
Okay, so it's my understanding that some of you could not hear the video. It was really clear on my end, so I'm not sure what's going on, but you can go back and see it. It's a 5-minute video, and once again, it's on the website for the Harvard Developing Child. So the link is right in the video, and you can just go right and get it. So please make a point to go sit in. And I'm sorry that you were not able to hear it clearly. So let's go. So basically what he talked about, the most important thing is that he talked about that we need to what? Understand the importance of developing, doing skill building with our adults. And he feels like that is one of the keys in terms of addressing all of this adversity. So quickly, we're going to go through the definition of these important terms. There's another video that's coming up that's on the YouTube, and I hope that you can hear it because it really is important and it sets the foundation. But if not, you let me know, then we can just talk through it and I can just tell you the highlights of it. So when we talk about trauma, we talk about what? It says individual trauma results from an event, a series of events, or set of circumstances that is experienced by the individual as physically or emotionally harmful or threatening and that has lasting adverse effects on the individual's functioning and physical, social, emotional, or spiritual wellness. So when we talk about trauma, as we go through this particular course, this is the definition that we're talking about. We talk about that there are all kinds of different kinds of trauma, and these are just some of the types. This is certainly not a comprehensive list, but when we think about trauma, these are just some of the things that we might want to think about. Once again, you will have a copy of this presentation and you can kind of go through it. So when I do it in class, we use this kind of like a basic list, and then we have a brainstorming, and there's probably 3 or 4 times as many of these different types of trauma. Because what is it about trauma? Trauma is unique and individual. What may be very traumatic for me may not even, ruffle you one way or the other. So we talk about traumatic stress, some of the things in terms of how it is people may be dealing with it. They may feel numb or shocked, avoid people or places that remind them of the event. Sometimes they have nightmares or strong memories as if reliving it. They may be afraid, angry, or sad. And these are just some of the symptoms of experiencing traumatic stress. They might have trouble sleeping, paying attention, feeling helpless, hopeless, being very tired or worn out, or just having aches and pains. So these are just some of the symptoms. Once again, this is not a comprehensive list, but just to let you know, once again, these are some of the symptoms. So when we talk about how it is, some of the things we might recommend in terms of when we know that families specifically are perhaps dealing with traumatic stress, perhaps see a doctor, see a school, they can see a counselor. I talked about see a trained spiritual leader, somebody who's been trained to deal specifically with traumatic stress and all that goes into that. We might talk about finding a mental health provider, who has helped families overcome traumatic stress. And depending on what kind of event or what has occurred, you might try to find a mental health provider that has expertise in that specific area. And when we talk about when we look for trauma treatments, we want to help with all members of the family, because trauma just does not impact the person that has experienced it. It is really a family experience. And sometimes even beyond that, it impacts our friends, it could impact our community. So once again, depending on what kind of trauma it is, we really need to figure out how it is we can helpfully identify who those folks are and what is it that we want them to do. We want to take them from a place of being unsafe to feeling safe. We want to be able to educate them about trauma, because sometimes people have no idea, what is this I'm experiencing? How is it that I need to deal with this? So if you can educate somebody about, what is trauma, kind of what is done to you, or what does it look like and feel like to you? Education is so key in so many things that we do. We could talk about, perhaps help them to come up with some effective strategies in terms of how it is that they're going to deal with that particular type of trauma, whatever that happened. We need to recognize, once again, I'm going to go back time and time again in terms of how it is that we build on the family strengths. And then we're going to talk about ways to get the family back on track. So these are just some generic things that we can do. You don't have to have a degree to do these things. You can just be a family member, or you can just be a provider like myself, a trainer that knows about these kinds of things. And you can, if you're specifically a provider, you can go into more detail in terms of making these things actually happen for the families, depending on what kind of product or service you are bringing to the table. So quickly, we're going to talk about that there are 3 kinds of stress. There's this thing that we call positive stress, which talks about, it's a state what it says that is brief and mild and moderate in magnitude. And really, they say that we need to be able to experience positive stress. And some of the examples they give is like when you're going to take a test, you need to be a little geeked up, you need to be a little excited, you need to be a little, ready for that. So there's this thing called positive stress, and that's the good kind of stress. So what happens is we have stress, it goes up, it immediately comes down, and we're back. Everything goes back to regulation. So positive stress is good for us. Then we have the second kind of stress, which is called tolerable stress. And when we talk about tolerable stress, this is the kind of stress that says serious, some sort of a serious event, or events, set of circumstances has happened. And the stress response, it says, but the key is temporary. And the second thing, it is buffered by a supportive adult. So one of the things we're going to talk about in a minute when we talk about toxic stress is that there is no buffering adult. Okay, so with tolerable stress, some of the examples they give, if somebody perhaps was in a car accident, it was a serious accident, perhaps there was a long healing process that was involved, but the key was this person, the stress was not going to go on for the rest of their lives, and the fact that there was a supportive adult, or that there was a supportive community that was a part of that to help that individual get through that event. And once again, even though the stress level goes up, it may stay up for a while, but at some point it does come back down and allows everything else to get back into regulation. So this is the serious and the dangerous stress. So when we talk about toxic stress, look at that definition: extreme, frequent, or extended activation of the stress response. And the stress response is what? Is when we are in our flight or fright mode. We know that something's getting ready to happen. The adrenaline goes up, the cortisol gets released, the heartbeat goes up, the blood pressure goes up. So all of these things, we're having this physiological and this emotional reaction to there's danger, danger. But what happens is with toxic stress, it goes up, but it doesn't come down because it is extreme and frequent to the point where it never just comes down and the body goes back to normal. It's like you're always on alert. Something's always getting ready to happen. So that's the danger. And the second thing, what it says, without, there is no supportive adult that is helping this child get through this event. So the key between that tolerable and that toxic, the duration, the frequency, and the presence or lack of that supportive adult, that is absolutely key. So just want to quickly talk about the social determinants of health. So when we talk about, we're going to talk about this adverse childhood experiences study, but I think people also need to understand that there's this thing called the social determinants of health, and they are what? They are the conditions in which people are born, grow, live, work, and age. And basically what we're saying is, if you look across this spectrum, there are like, 6 different areas that, depending on how it is, where you're born, how you live, how you grow, what that looks like, these things could end up being adverse childhood experiences too. If you are in, if you have poor employment opportunities for your parents, they don't make a whole lot of money, they have lots of expenses, are in lots of debt, they can't necessarily get you good medical care, can't pay the medical bills, there's no really support for them. What do you think that's going to look like in terms of how it is they're going to necessarily be able to bring and to support you as a child? So when we look across these social determinants of health, how it is depending on, once again, how we experience these things, how do they impact our mortality, our morbidity, our actual life expectancy, our healthcare expenditures, the health status, as well as our functional limitations. So this is a whole body of work, but it's a body of work that has been around for years, and it really talks about how is it that we look at, from a structural standpoint, how do we look at policies and practices that are in place that impact people in these 6 different areas. So normally, if I was in class, I'd take a poll, just to get an idea of the people in the class, what kind of knowledge they have in terms of this whole adverse childhood experiences, because once again, at this point, we all need to understand the impact and significance of this study. So I'm going to talk a little bit about it. First of all, there's 3 different people that whenever I talk about the ACES study that I always talk about. The first person that most people know is Dr. Vincent Felitti. He is one of the co-developers of the study. And he came about doing the study as a consequence of a weight loss program that he was involved in. People were like doing extremely well. And this was not surgery. This was just, a fasting weight loss program. They were meeting their objectives. All of a sudden they stopped. He ended up finding out that people were not only, they were leaving the program because of untreated childhood adversity. And a lot of it linked to that they wanted to be obese because they had been sexually assaulted and molested as children or as young people. And now that they had lost all this weight, they felt like they were getting the sexual attention again, and they didn't want it, so they went back to putting on the weight. So he ends up what? So he ends up going to an obesity conference where he meets Dr. Robert Anda, who works for what? The Center for the Study of Disease Control. He makes this presentation. He only has like 280 something people, in this study. He talks about it to, at this conference. They like blow him off, but Dr. Anda says, there's something to that. But unless we do a full-blown study that we can really validate what it is we think that you're seeing and hearing, then it won't have any validity. So Dr. Anda from the CDC and Dr. Felitti from the Kaiser Permanente organization got together, co-developed this study, and rolled it out. And the original study was done like in 1995. Okay, so the third person that I always talk about, she has nothing to do with the study, but she has become probably the most predominant person other than the 2 of them in terms of talking about what the ACEs is, the impact of it, the fact that we need to look at, she talks about screening, we need to look at prevention, we need to look at how it is that we really treat this. So for those of you who don't know, her name is Dr. Nadine Burke Harris. She is currently, as of, I think, January of 2019, she became the Surgeon General for the state of California. And her claim to fame has always been talking about ACEs. So she started talking about ACEs when she opened up a clinic in this area called Bayview in San Francisco, which was a community where they basically, a lot of poor people lived, underserved people. She opened up this clinic. At the time when she opened up the clinic, there was 1 pediatrician for every, get ready for this, 10,000 1,000 children. Okay, so her thing was once she started treating these kids, she didn't know about ACEs. At first she said, but there's something, everybody wants me to give their kid an ADHD diagnosis. There's something wrong with these kids. She says, I know there's something wrong with these kids, but I'm missing something. Well, one of her colleagues introduced her to the ACEs study. Once she got educated on the ACEs study, she says, now I understand that now my kids are dealing with all of this toxic stress, all of these adverse childhood experiences. And then she says, now I understand how it is we need to bring ourselves to the table to understand the impact of how these adverse childhood experiences are impacting our children. So she has become the premier spokesperson, other than Falidi and Anda, who own the study. She really has taken it across the nation. Everybody is getting to know her. I mean, she has talked to Congress. She's talked to everybody. She's written a book, and the book is called The Deepest Well: Healing for Long-Term Effects of Childhood Adversity. She presents all over the world. I mean, all over the nation. So she's pretty phenomenal. So I call them the king of ACEs, and I call her the queen of ACEs. Okay. So she has a TED Talk. So I need you to, Chris is monitoring the chat for me. So I'm hoping that you can hear this TED Talk, but if not, I need you to let me know. And if you don't hear it, then I'm just going to cut it off because I don't want you to go through 14 minutes of not being able to hear it. But I do need you to go back at some point. But everything that she talks about in this video, I have on PowerPoint, and I'm just going to quickly go through it in PowerPoint if she talks about it. And if not, if you can't hear the video correctly, then what I'll do is I'll go into more detail in terms of the PowerPoint, because I really do want you to understand the power of this ACEs study. Okay, it is a TED Talk. So once again, if something happens and it's not coming across clearly and you have to listen to it on your own, that's the link. I need you to do that, whether you hear it now or later. It is powerful.
In the mid-90s, the CDC and Kaiser Permanente discovered an exposure that dramatically increased the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or packaging chemical. It's childhood trauma. Okay, what kind of trauma am I talking about here? I'm not talking about failing a test or losing a basketball game. I am talking about threats that are so severe or pervasive that they literally get under our skin and change our physiology. Things like abuse or neglect, or growing up with a parent who struggles with mental illness or substance dependence. Now, for a long time, I viewed these things in the way I was trained to view them, either as a social problem, refer to social services, or as a mental health problem, refer to mental health services. And then something happened to make me rethink my entire approach. When I finished my residency, I wanted to go someplace where I felt really needed, someplace where I could make a difference. So I came to work for California Pacific Medical Center, one of the best private hospitals in Northern California. And together, we opened a clinic in Bayview, Hunters Point, one of the poorest, most underserved neighborhoods in San Francisco. Now, prior to that point, there had been only one pediatrician in all of Bayview to serve more than 10,000 children. So we hung a shingle and we were able to provide top quality care regardless of ability to pay. It was so cool. We targeted the typical health disparities: access to care, immunization rates, asthma hospitalization rates, and we hit all of our numbers. We felt very proud of ourselves. But then I started noticing a disturbing trend. A lot of kids were being referred to me for ADHD, or attention deficit hyperactivity disorder. But when I actually did a thorough history and physical, what I found was that for most of my patients, I couldn't make a diagnosis of ADHD. Most of the kids I was seeing had experienced such severe trauma that it felt like something else was going on. Somehow, I was missing something important. Now, before I did my residency, I did a master's degree in public health. And one of the things that they teach you in public health school is that if you're a doctor and you see 100 kids that all drink from the same well, and 98 of them develop diarrhea, you can go ahead and write that prescription for dose after dose after dose of antibiotics, or you can walk over and say, what the hell is in this well? So I began reading everything that I could get my hands on about how exposure to adversity affects the developing brains and bodies of children. And then one day, my colleague walked into my office and he said, Dr. Burke, have you seen this? In his hand was a copy of a research study called the Adverse Childhood Experiences Study. That day changed my clinical practice and ultimately my career. The Adverse Childhood Experiences Study is something that everybody needs to know about. It was done by Dr. Vince Felitti at Kaiser and Dr. Bob Onda at the CDC, and together they asked 17,500 adults about their history of exposure to what they called adverse childhood experiences, or ACEs. Those include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. For every yes, you would get a point on your ACE score. And then what they did was they correlated these ACE scores against health outcomes. What they found was striking. Two things. Number one, ACEs are incredibly common. 67% of the population had at least one ACE, and 12.6%, 1 in 8, had 4 or more ACEs. The second thing that they found was that there was a dose-response relationship between ACEs and health outcomes. The higher your ACE score, the worse your health outcomes. For a person with an ACE score of 4 or more, their relative risk of chronic obstructive pulmonary disease was 2.5 times that of someone with an ACE score of 0. For hepatitis, it was also 2.5 times. For depression, it was 4.5 times. For suicidality, it was 12 times. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, the #1 killer in the United States of America. Well, of course, this makes sense. You know, some people looked at this data and they said, come on, you have a rough childhood, you're more likely to drink and smoke and do all these things that are going to ruin your health. This isn't science. This is just bad behavior. It turns out this is exactly where the science comes in. We now understand better than we ever have before how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior. And that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis, the brain's and body's stress response system that governs our fight or flight response. How does it work? Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear. But the problem is what happens when the bear comes home every night. And this system is activated over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health-damaging. Children are especially sensitive to this repeated stress activation because their brains and bodies are just developing. High doses of adversity not only affect brain structure and function, they affect the developing immune system, developing hormonal systems, and even the way our DNA is read and transcribed. So for me, this information threw my old training out the window, because when we understand the mechanism of a disease, when we know not only which pathways are disrupted, but how, then as doctors, it is our job to use this science for prevention and treatment. That's what we do. So in San Francisco, we created the Center for Youth Wellness to prevent, screen, and heal the impacts of ACEs and toxic stress. We started simply with routine screening of every one of our kids at their regular physical, because I know that if my patient has an ACE score of 4, she's 2.5 times as likely to develop hepatitis or COPD. She's 4.5 times as likely to become depressed, and she's 12 times as likely to attempt to take her own life as my patient with 0 ACEs. I know that when she's in my exam room. For our patients who do screen positive, we have a multidisciplinary treatment team that works to reduce the dose of adversity and treat symptoms using best practices, including home visits, care coordination, mental health care, nutrition, holistic interventions, and yes, medication when necessary. But we also educate parents about the impact of ACEs and toxic stress the same way you would for covering electrical outlets or lead poisoning. And we tailor the care of our asthmatics and our diabetics in a way that recognizes that they may need more aggressive treatment given the changes to their hormonal and immune systems. So the other thing that happens when you understand this science is that you want to shout it from the rooftops, because this isn't just an issue for kids in Bayview. I figured the minute that everybody else heard about this, it would be routine screening, multidisciplinary treatment teams, and it would be a race to the most effective clinical treatment protocols. Yeah, that did not happen. And that was a huge learning for me. What I had thought of as simply best clinical practice, I now understand to be a movement. In the words of Dr. Robert Block, the former president of the American Academy of Pediatrics, adverse childhood experiences are the single greatest unaddressed public health threat facing our nation today. And for a lot of people, that's a terrifying prospect. The scope and scale of the problem seems so large that it feels overwhelming to think about how we might approach it. But for me, that's actually where the hope lies. Because when we have the right framework, when we recognize this to be a public health crisis, then we can begin to use the right toolkit to come up with solutions. From tobacco to lead poisoning to HIV/AIDS, the United States actually has quite a strong track record with addressing public health problems. But replicating those successes with ACEs and toxic stress is going to take determination and commitment. And when I look at what our nation's response has been so far, I wonder, why haven't we taken this more seriously? You know, at first, I thought that we marginalized the issue because it doesn't apply to us, right? That's an issue for those kids in those neighborhoods, which is weird because the data doesn't bear that out. The original ACES study was done in a population that was 70% Caucasian, 70% college educated. But then, the more I talk to folks, I'm beginning to think that maybe I had it completely backwards. If I were to ask how many people in this room grew up with a family member who suffered from mental illness, I bet a few hands would go up. And then if I were to ask how many folks had a parent who maybe drank too much, or who really believed that if you spare the rod, you spoil the child, I bet a few more hands would go up. Even in this room, this is an issue that touches many of us. And I'm beginning to believe that we marginalize the issue because it does apply to us. Maybe it's easier to see in other zip codes because we don't want to look at it. We'd rather be sick. Fortunately, scientific advances and frankly, economic realities make that option less viable every day. The science is clear. Early adversity dramatically affects health across the lifetime. Today, we are beginning to understand how to interrupt the progression from early adversity to disease and early death. And 30 years from now, the child who has a high ACE score and whose behavioral symptoms go unrecognized, whose asthma management is not connected, and who goes on to develop high blood pressure and early heart disease or cancer will be just as anomalous as a 6-month mortality from HIV/AIDS. People will look at that situation and say, what the heck happened there? This is treatable. This is beatable. The single most important thing that we need today is the courage to look this problem in the face and say, this is real and this is all of us. I believe that we are the movement. Thank you.
Okay, so she talked about a lot of different things. She talked about the importance, she talked about what the ACES study was, she talked about why it was important, she talked about really what it looks like in terms of how that early adversity impacts us across the lifespan. She talked about the fact that this is the #1 unaddressed public health crisis that we are facing. She gave some strategies in terms of things that we could be looking at in terms of this particular addressing the ACEs. She talked about her wellness clinic. So she talked about a lot of different things. So the slides that I have coming up next are nothing more than a synopsis of what she's already talked about. So I'm going to quickly go through them. But this is a wonderful quote by Maya Angelou, and she says what? There is no greater agony than bearing an untold story inside of you. And one of the things that I have learned with people that have experienced trauma, so many of them never, ever tell that story. Or they would have experienced something in childhood and now they're like at the end of their life, or they're like 30 years later and they finally feel like they're going to share with somebody. And why? Because they felt like somehow they caused it. There's all this shame and this regret and things that they have no reason that they should be feeling these things. Okay, so quickly, this is the history. You have these on your slides. I'm not going to really go through them quickly. The study was what? The original study was from 1995 to 1997. It had over 17,000 people. And to this date, it is one of the largest investigations of childhood abuse and neglect and how it is that relationship relates to later life health and well-being. This was a study population, and you have all these slides, so I'm not going to go through them, but basically what did she say? 70% Caucasian, 70% of them were college educated, and these were middle class people. This study took place in San Diego, California, so these are some people that had a little bit of money, okay? So then it talks about, once again, if you want a copy of that calculating your ACE score, if you'll send me an email, my email is going to be at the end of this presentation. I will send you a copy of it. Or you can just Google it, you want to calculate your ACE score, and there are 10 questions. So basically, 17,000 people surveyed, 10 questions. Those 10 questions, she said what? Abuse, neglect, and household dysfunction. 5 of them talked about physical, verbal, sexual, physical, and emotional abuse and neglect that the child experienced. The other 5 were related to what they would have experienced as living in a family: parents alcoholic, domestic violence, incarceration, living with someone diagnosed with mental illness, or the disappearance or abandonment of a parent. What did she say? These 2 major findings. One of them was that at least, what she said, 70% of them had experienced at least one ACEs, and this, okay, 36% had experienced at least one ACEs, and then 12.5% had experienced at least 4 or more. Then, so the whole idea was, and I'm not going to talk to this, but basically what happens is she talked about the relationship between, as the higher number of ACEs that you've experienced, once again, it's on a scale from 1 to 10. For each one of those that you may have experienced, there's a count of 1 point. So what the study showed was basically, as the number of abuse, physical, emotional, sexual abuse, whatever those 10 questions were, which are on my left-hand side, as those numbers increase, so there's a higher incidence of what? Depression, alcoholism, drug abuse, suicide attempts. They had a correlation for each of those, and you can go back and actually find them. She even quotes lots of them when she's giving her presentation. She talks about, if you have like an ACE score of 4 of this, what is your probability of having ischemic heart disease? So that information is public information if you want to go and actually get it. But just listen to her report, and she will give you a lot of that information without you even having to do any other research unless you want to. So once again, it says what? As the number of ACEs increases, so does your risk for the following. And these are just, not only physical diseases, they're mental issues, suicide, pregnancy, poor academic performance. A lot of them are physical, a lot of them are social. So really, they really talk about really not only just physical ills, but also social ills that come as a result of, once again, those. And we need to talk about the fact that if these adverse childhood experiences remain untreated, these are what the things that they found out. So in summary, once again, the adverse childhood experiences was used to assess cumulative childhood stresses. Came across that they were common. What, almost 2/3 of the study participants reported that they had at least one ACE, and more than 1 in 5 reported 3 or more. And she talked about that dose-response relationship. Once again, the higher number of ACEs that you have, the more probabilities that as you go across the lifespan that your health outcomes are going to be poor. And also she talks about even I talk about the quality and the quantity of your life, even to the point of that your life can be cut short by 20 years, depending on the number of those ACEs that you have experienced and that remain untreated. Phenomenal piece of work. And if you go down to the CDC, they have more information on this study than anybody else. So if you really want some additional information on the study for your own purposes, go to the CDC website. So one of the main things that came out of this whole body of work, it went from what I call a shift in perspective from, why is this child acting out or engaging in this kind of behavior? Because before, all we ever looked at was, this child is acting out, they have bad behavior, they're acting a fool, or, this child doesn't know how to act. Well, that no longer is the question. The question becomes now is, what has happened to this child? Because we know that now that behavior is motivated by something. So it's no longer look at the child's behaviors. What is causing this child's behavior? What sort of adversity has this child experienced that is causing them to behave in this fashion? So that's the whole paradigm shift. When people now talk about this ACES study, it's a shift in thinking. Stop focusing on the behavior, start focusing on what is causing the behavior. Okay, and I'm just going to quickly talk a little bit about brain development because I want to make sure that we have a little bit of time to answer questions at the end. And I have lots of information, and some of it I'm not going to go through, and I'll tell you what those slides are. And once again, because you'll have them, you can just be able to review them on your own. But the whole idea behind brain development in children, and that is the big thing, is brain science. I mean, everybody's talking about it. And just to have a basic understanding, basically, we are born with brain cells. There's like billions of brain cells that we're born with. And as children, we're born with a blank slate. So how is it that those brain cells start to develop? Well, they develop based on the experiences that we have, which is the nurture. So every time we have an experience, there's some sort of connection made between some kind of brain cells. And these brain cell connections are called synapses, or they're called pathways. So the pathways are, if I have an experience, the brain says, I'm going to connect these two neurons together. This is going to be, how I interpret this experience. And based on those pathways, they create these things called templates. And templates are the way in which we see the world. So a perfect example is, if I have experienced something over and over again. So if I walk into a room and I think that, I go to school and I walk into a classroom, what do I expect to see? I expect to see some chairs. I expect to see a teacher's table. I expect to see, some other things depending on what kind of a classroom it is, maybe some, learning stations. So that's my expectation. That's based on my template. That's based on the way that I see the world because of the things that I experience. So if I walk into a yoga studio, that's not what I expect to see. I expect to see mats on the floor. I expect to maybe see, someplace where we can get some water. It's going to be nice, soft music. So once again, we're born genetically with these brain cells, but our environment, and this is the key, the environment shapes these synapses, these pathways, and these pathways create these templates. And the templates become the way that we see the world. So depending on those experiences, whether they are positive experiences or negative experiences, the brain does not know. The brain just knows this is an experience, this is a pathway I'm going to create, and this is a template that I'm going to create. So when we say that we are shaped, the brain is shaped by our experiences, absolutely. So think about if you have a child that is constantly going through these adverse childhood experiences, how do you think they're going to see the world? It's going to be a frightening world. It's going to be a place. How do I find myself safe? They're going to always be what? Probably in a state of hypervigilance. So once again, the key behind the brain science is that the environment is what shapes the brain. Key. I cannot express that enough. So, and this just gives you some more information that I've already talked about, but what's really critical, think about once again, that a child, when infants are born, there's a clean slate there. They're not born with neurons that are already connecting, that they already kind of have an idea. No, from the very beginning, think about how the way we interact with our children. What is it our children need from us? They need loving, they need nurturing, they need for us to attend to their needs. They are completely depending on us. And how it is we react to that, how it is we nurture them, how it is we do that return and serve, what does that look like and feel like? We start really building the basics for in terms of their brain development. That is absolutely so key. The one here, what it says, every new experience creates a new connection in the brain. What happens is if there's an experience that's similar to another one, it kind of says, this kind of looks familiar, and it kind of so it goes back to the one that it looks familiar with and kind of strengthens that pathway. But it says between the ages of 2 and 10, a child's brain contains 50% more synapses. Once again, these pathways, these connections, these experiences in terms of formulating these templates in our mind so that these children will know how it is they're going to interpret the world. So this is just an example, and it shows you that a newborn, once again, these synapses are the connections. Every time something happens, there's a connection between some brain cells. So when we're born, there's not a whole lot of synapses. At 1 month, you see there's more. At 6 months, there's more. And by 2 years, there's more and more. And these synapses continue to develop throughout our childhood. Dr. Burke kind of talked a little bit about this. Oh, no, this was in the developing brain. I'm sorry. Let me slow down. This really talks about, if you go back to the video about increasing the adult capacities, it really talks about what the brain's ability to change a response to experiences. So if you see that at the age of 2, and these are the age at the bottom. So it's highest at the age of 2. So we're saying when we are younger, that's the greatest time for our changes, our brain's ability to change based on whatever these experiences are. And as the older we get, our brains, our brain capacity to make those changes slows down. It never stops, but it just slows down. And then it even talks about the amount of effort that's required to make such changes. Once again, it doesn't take a whole lot of change and effort at the tender ages, what between 2 and that, that emerging adult, what happens like about the mid-20s. But then after that, what it starts taking more and more effort in terms of for us to make those changes. But once again, throughout our lifespan, the brain always has the capacity to change, but at what rate and at what way will that look like and feel like? And that really is very age specific. So in terms of brain development, and you can read this, it just talks, you can read these for yourself, okay? But the key here is that there's 2 times in life where the brain does this thing called a pruning process. And the pruning process, oh my God, says there's too much stuff in this brain. It's time for me to get rid of some stuff, okay? And to get ready for the next like significant phase in this child's life. One is like between the ages, they say around the age of 36 months. So it really is normally between the ages of 3 and 4. And what happens at that point is the brain says, I'm going to do a data dump. And it says the brain doesn't know if I'm getting rid of good stuff or bad stuff. The only thing the brain knows is I'm getting rid of stuff that's either used all the time or stuff that's hardly ever used. If you don't hardly ever use it, the brain is saying, I don't need it, so I can get rid of it. So think about that as the pruning process. It's getting rid of that is not used. So, and if the brain doesn't know if it's good stuff or bad stuff, if this child has lots of good stuff, that's what's going to be left. But if this child has lots of bad stuff, then that's what's going to be left. So we want to make sure that at all points, to the extent that's possible, that these children have as many positive childhood experiences that we can, and that we somehow are able to mitigate those adverse childhood experiences. The second time the pruning process takes place is right before puberty. So those are the only 2 times in life where our brain says, I'm getting ready to do a data dump because it's time for me to get ready for the next phase. But that is so key and imperative that we understand that. So these are just some factors, before birth, after birth, and, in terms of what impacts a child's brain development. This just talks about, for those of you, and I'm sure everybody on this call probably has a basic knowledge that the brain develops from the bottom up and the inside out. So it develops first, you have the brain stem where you have those basic functions in terms of us being able to breathe, the heartbeat and things like that. Then the next thing that develops is the limbic brain. And that's where there's 2 kind of important pieces there. There's this emotional piece that controls our emotions. And then there's the piece that controls our learning and memory. Those are not the only 2 pieces, but those are the 2 important pieces in the limbic. And then the third piece is what they call the critical brain or the prefrontal cortex. And that's where those executive functions come in. Those are the functions that hopefully have been developed by the mid-20s. People think that, these kids at 18 and 19, they're able to think like adults. They're not. That prefrontal cortex does not stop developing until the mid-20s. So why do we treat these teenagers like because they turn this mystical, magical age of 18 and 19, like, oh my God, they ought to act like adults. No, their brain has not completed those executive functions yet. The ability to think and act like adults. So when we talk about, so once again, this just talks about what the prefrontal cortex, it talks about what those executive functions are, the amygdala. That's what ends up happening when we feel, when we go from a calm state to what I'm going to call a state of alert, or we are triggered, or something makes us think that something's getting ready to happen to us. That's where those emotional responses come from. And that's where once our amygdala is activated, then those cortisone is released, the adrenaline is released. And so what happens when you have that state where those 2 hormones are released? As long as they go up and they come down in a reasonable amount of time, they don't do any real damage. What happens is when you leave them up for extended terms, when there's chronic and frequent adrenaline and specifically cortisol in your system, they will attack your immune system. They will attack your the other hormones. They will attack in terms of the way that your brain is being structured and wired, the function of your brain. So that is the danger when you have cortisol in your system for a long time and it doesn't come down. It physically and mentally is really impacting and I don't want to say destroying, but in some ways it really is, because it's so busy trying to just to keep you alive, because that's the purpose of what they call this primitive brain. The whole purpose of the brain, people think it's to coordinate all the stuff that you do in your body, and absolutely it does that. But the primary function of your brain is to keep you alive at any cost. So if it becomes an issue of, do I need to be thinking about, some executive function? If I'm scared to death about something, how is it that I'm going to react to that in a flight and flight mode? How is it that I'm going to react to that? I'm going to do whatever I need to do to make myself, or try to make myself, safe again, whatever that looks like and feels like. And a lot of times when people get into that state, they don't think rationally. They don't think, from using those prefrontal cortex, especially, and children don't even have those things developed. So we need to help our children understand the concept of when things start going in a way that are not comfortable. How is it that, what does this emotion look like? What are some skills for you for self-regulating those emotions as a child? So she talked about it. Remember, she said, what if you felt like as a child, if you had a bear chasing you in the forest all day long? And she said, well, right, we don't live in the forest, but what if the bear is the person, your parent, that comes home? Could be an alcoholic, or the things that you have to deal with. Think about what that looks like when you are in that state constantly. So we've already talked about these 3 different kinds of stress: positive, tolerable, and toxic. We've already talked about these stress hormones. Once again, when they're activated, when our body feels like there's something going wrong, we go from a calm state to one of alert, terror, or whatever. What those cortisone levels are gonna go up. We'll go to a state of hypervigilance, because our body is saying, get ready for something. So these are just next couple slides just really talks about what happens when there's elevated stress, there's toxic stress. So if you look at this one, it shows the normal, typical neural connections. Remember, I talked about those synapses. That's what this is a picture of. So the one at the top is a picture of a typical or a healthy neural connection. And if you look at the bottom, you see that there's a difference in terms of what the prefrontal cortex and hippocampus looks like. It's damaged, and therefore it ends up damaging the neurons of those connections. So physically, these are things that are going on in the brain due to these chronic, frequent, and toxic adverse childhood experiences. Another one, it shows when they looked at the brain of an institutionalized child versus one that had never been institutionalized. If you look at the colors say, the one at the bottom, that's the way the normal brain should look like. All of that activation means that there's things that are going on in the brain that should be. It says the brain's activity can be measured in electrical impulses. Hot colors like red and orange indicate more activity, and each column shows a different kind of brain activity. Young children institutionalized in poor conditions show much less than the expected activity. So once again, these adverse childhood experiences, whatever they are, and it's not just those 10 that are on that study, there's all kinds of other adverse childhood experiences, but they are impacting this child, the physical makeup of this child, in terms, but specifically when we look at how it's impacting the brain. This is another thing. So this was a PET scan that was made, and this was taken from, it says the PET scan of the brain of a Romanian orphan. If you look at the one on my right, and it may be your left, but it says the abused brain. If you look at, there's all these missing pieces when you compare it with the healthy brain. When you see the PET scan of the healthy brain, all of that red stuff, all that stuff that should be in there, that should be working, those are parts of the brain that we need to have a healthy brain. When you go over to that abused brain, look at how much of that stuff is missing. And it says, that these kids shows the effect of extreme deprivation in infancy. So what happened in these Romanian orphanages, oh my God, there were so many kids that all they could do was like to change a diaper every once in a while and give them a bottle. There was no loving, there was no nurturing, there was nothing like that at all. Nothing. And so physically, you can see the difference in the brain in terms of how that lack of nurturing and caring and all the things that these children needed, what it looks like in terms of the development of that child's brain. These are powerful. So this is the science. This is not, you have to convince somebody. This is the science. And another one, this is another one shows, once again, this was a brain scan of a normal 3-year-old child. This was done by a study by Dr. Bruce Perry, and you can go check him out. You guys probably already know who he is. He's this fantastic pediatrician that knows all this stuff about brain development, toxic stress, and everything. So this came out of a study he did, and it shows physically, not only, we talk about all those missing pieces in the prior one when they did the PET scan, and this one you can see physically that the brain is even a smaller size. So once again, these were children that were extremely neglected. The science speaks for you. Okay, so these next slides, I'm not even going to go through them because you have them and you'll be able to go through them, but it just really talks about the trauma impact, possible trauma impact in terms of how it looks from 0 to 12. So just lots of information, and I don't need to go because once again, you can do this on your own, but I just needed you to be able to see. Now we've jumped from 0 to 12. Now we're looking at children from the ages of 3 to 5, what that trauma impact might look like. Okay? So we need to understand what it impacts their learning, their memory, all the things that make our children to be healthy, to be healthy children, whether it's physical health, whether it's mental health, whether it's emotional health, or whether it's social health. All those things are impacted when our kids experience trauma, untreated trauma, extreme trauma, toxic trauma. So these are just some of the things that they may experience. More stuff about the trauma impact, okay? And this even talks about what I did not know before I started doing this body of work. I did not realize that there was PTSD that children can actually have. And no, it's not like the PTSD of an adult, but children can actually be diagnosed with PTSD. It is a diagnosis. So once again, this is some more information for you, and you can look at it on your own. But I love this information because it really talks about from an infant, toddler, it kind of breaks it up from school age and then adolescence. It talks about what happens when we have these kids that have experienced trauma, what could be the response. It talks about how it affects their memory, how it affects their self-control in terms of their emotions, and how it even affects their cognitive ability. So a nice handout for you to have. Some more, and I think this is important because sometimes we look at kids, we make judgments, we don't necessarily know what the real cause of something is, but it really says that sometimes children can respond in a certain way, and sometimes we totally misdiagnose it. So this is a nice slide to have too, and it has where the information was obtained from at the bottom of the slide. Okay, now I'm going to quickly talk about these protective factors. Because I do want to have at least 10 minutes at the end to do questions. So when we talk about these protective factors, it says by mobilizing partners, communities, and families to build family strengths and protective factors, we can promote optimal development and reduce child abuse and neglect. So these protective factors were really designed originally by the Center for the Study of Social Policy, and that's the CSSP organization. And there's a slide at the end that gives you a link to that organization. They have all the materials at that website are free. Absolutely free. They have presentations, they have trainings, you name it. If you want to know about the protective factors, if you want to know about Youth Thrive, they don't have very much on Family Thrive, but they do have a little bit. But they are the owners of those curriculums, and they have all kinds of information. So what they have really discovered is that if these protective factors are present in their families, they are a powerful set of tools to put into your toolkit. And I tell people all the time, they personally changed my life. They changed my life in terms of the way that I said that, oh my God, if I would have known about these protective factors, my kids are like 42 and 32. If I would have known about them when I was a parent, I think I was a pretty good parent, but I would have been a much, much better parent if I would have known about them and would be able to apply them. But that's okay, because they really have even changed the way that I interface with my adult children. But more importantly, they've changed the way that now I interact with my grandkids. I have a 13-year-old and a 3-year-old grandson. I am a totally different grandmother now than I know that I would have been, because I know about these protective factors. I know how to apply them. I know about the power of them. And I just try to teach them to everybody, because this is not brain science. This is not rocket science. This is just, if you understand what it is and how to apply it, it will make a difference in your life as a parent, a caregiver, or provider. Whatever that role is, it will make a difference. They are powerful. So this was a quote by Carl Bell, who is a psychiatrist, and he is really very familiar with these protective factors. He talks about them across the country, but he says what? That risk factors, which are all the reasons that why we look at families in the first place. Oh, they have this long list of risks, and we want to be able to provide our products and services to hopefully to help mitigate those risks. He's saying, well, if you have these protective factors, it's one more set of tools in that toolkit to mitigate those risks, and they can be applied across the board. It doesn't matter how much. I said, tell people, I don't care how much money you make, how many cars you got in your garage, I don't care what kind of car you got, I don't care what kind of house you have. These protective factors, you can apply them to anybody and anywhere. Oh my God, that is the power of them. Okay, but before I say anything about these protective factors, if you didn't know about any of them, the most important protective factor that you need to know is that everybody has said if a child has at least one trusting, loving, caring, and safe relationship with at least one, they would prefer to be a parent, but if it can't be a parent, if it's an adult or if it's another caregiver, that is the most powerful protective factor, which is not one of my five. Okay, it's included, but it's not one by itself. But one more time, if you didn't even know about my five, if you know about this one, this is the game changer, y'all. And I tell people all the time, think about it. You can be that one parent, adult, caregiver, whatever that relationship is. You can be that safe place for that child to come to. No matter what goes on, you are going to be there to help that child navigate and maneuver whatever that adversity is, whatever those challenges are, whatever those things are that are, getting them stuck there. They're saying, I can't do this. I'm not equipped to do this. I'm a child. You can be that person that can make the difference in a child's life. And I guess I thank you, because I bet you every person on this line is, deals with families, cares about families. You have committed to do this work, and this is hard work. This is, they say it's messy work sometimes. I don't know what you want to call it, but it is the most fulfilling and rewarding work that you can do. And I applaud you that you have brought yourself to the table to do it, because our families need our help. We are here to help them with that skill building. We're here to help them to see the good things that they do in life. We're here to help them increase their capacities and capabilities to be better parents, to be better caregivers, just to be better people. And we are honored and blessed that we are able to do that. So I thank you for bringing yourself to the table to do this work. So the 5 protective factors are parental resilience, social connections, concrete support in times of need, knowledge of parenting and child development, and the social and emotional competence of children. And I'm just going to quickly go through them, but basically what you need to know is that the Strengthen Families Protective Factor, it's a framework, it's an approach, and what it talks about, it benefits all families. We build on what family strengths. It talks about buffering risk, and it does definitely promote better outcomes. It can be implemented through what we call small but significant changes in the way that we as providers bring ourselves to the table, or even as we as parents, if we learn how to do things differently, to see things differently and to be different. Builds on and can become part of existing programs, strategies, systems, and community opportunities. This is not a standalone. This is something that no matter what you're doing, we say, bring it and integrate it into what you're already doing. Don't create it. It's not a standalone, y'all. It's meant to be integrated into whatever that thing is that you're already doing. It is grounded in research, practice, and implementation knowledge. It is research-based. It is not research evidence. It is research-based and evidence-informed. Once again, implemented through small but significant changes. It is not parallel to. However, we want you to integrate it into whatever your program, your services, whatever this is that you're doing, you can make it integrated into that. It can be applied in any setting. And we talk about that. It's a cross-sector implementation as the core for their approach. So our thing is we want everybody to know about these protective factors so we can have a common language, a common approach that will benefit our families. So it is completely aligned with the development of science, because this whole thing is based on what? That we understand there's critical periods of development, especially between the ages of 0 and 2, which is those first early, those first 1,000 days. Those are so key and critical, and as well as the ages between 3 and 5, those early childhood stages. We need to make sure that our caregivers, whoever they may be, understand the importance of what those nurturing relationships are all about, and that they also understand the impact and effects of trauma on development, behavior, and the outcomes of their children. So what do we know? We know that families gain what they need to be successful when these key and promotive factors are robust in their communities and in their lives. So the first one talks about parental resilience. there is a short video here, and I'm not sure that it's going to work, but let's just bypass the video, okay? But basically, all the video really talks about, what is it that resilience is? It's really our ability to overcome all of those challenges, all of those struggles, that adversity that that we encounter, and what does that look like? So it says resilience is what's a process of managing stress and functioning well even when faced with challenges, adversity, or trauma history. And all of us have experienced, either challenges, adversity, or trauma history, and sometimes we've experienced all of those. So when you think about, just some of the stressors that we encounter, this doesn't even include COVID and all the craziness that has brought to the table. And that's another whole bailiwick when we talk about additional stressors that we've had to learn how to deal with just over this last year and a half. So why is resilience important? When we are resilient, when we have coping mechanisms, positive and fruitful coping mechanisms that will help us deal with this adversity, these challenges, and this trauma, we're able to what? To face challenges. We can make good decisions. We're accountable for our actions. We don't try to say it's somebody else's fault. No, if this is something I did, I'm gonna own it. What do I need to do to fix it right? So there's a list of these things, but all of these things are important because the bottom line is these are successful strategies or outcomes if in fact we are resilient. Now, one more time, I'm just giving you like 2 little slides on each one of these, but when we do the class, we go into depth for each one of these protective factors. But I just want you to at least have an idea of what they are. Okay? The next one is social connections. And when we talk about social connections, this really talks about what? Positive relationships that provide emotional, informational, instrumental, and spiritual support. So those connections really come in terms of how it is people bring themselves to the table and that we are in relationships. And there's all kind of relationships we have. Nobody has one relationship that somebody can meet all of their needs. So how is it that we understand, what healthy relationships look like? How is it that we go out and seek those healthy relationships? And how is it that we make sure that when we bring ourselves to the table, that we are bringing ourselves to the table in a positive way, in a way that we are a part of what that healthy relationship feels like? We want to feel appreciated and respected. We want to give help, but we also need to be able to understand the concept of receiving help. We need to understand what are the skills that may be required in terms of just understanding how do you even seek, establish, and maintain those social connections. So this, to me, out of all the protective factors, I tell people, to me, this is the most important one because we don't do anything in isolation. Think about it. Everything we do is in the context of some kind of relationship, whether it is personal, whether it is professional, it doesn't matter. I don't know anything that I do from the time I wake up in the morning to the time I go to bed that I just do all by myself. Everything I do has a relationship with somebody, starting with me. God is the first thing that starts my day off. I'm in relationship with him all day, if nobody else. But I do have all these other people that I go to for other pieces of things that I need. So when we talk about the power of relationships, oh my God, I cannot stress the importance enough of healthy relationships that provide what? Positive emotional, informational, instrumental, and spiritual support. What do those relationships look like and feel like? So I love this quote. It says, the relationship very often is the intervention because the relationship is the context within which the young person learns and practices new ways of relating to people. So what this really talks about is sometimes when we bring ourselves to the table, when we're in a relationship, especially with these children and these young people, hey, it's nice that we can bring something to them, but when we bring ourselves in an authentic way, when we bring ourselves to them in a loving, caring, and nurturing way, when we let them know that we care about them, that we're here for them, that is the most important thing. And when you bring yourself to the table in that way, they will be open to you. They will want to work with you. But they've got to understand, but they've got to be at a place where they feel like they can trust you. You are a safe place. You are a caring place. You are a loving place for them to be. The power of the relationship. If you don't have a good relationship, think about how can you do anything for somebody if I'm not even in a relationship with you, or I don't even have a good relationship with you. The power of the relationship. So that is the key. So when we talk about these relationships, why are they important? What does this need to look like? It says healthy social connections promote what? A sense of trust, a sense of belonging, The fact that I care about you, you care about me, there's reciprocal positive regard, there's shared values, beliefs, and cultures, opportunity to share experiences. These are all positive things that come out of when we have those healthy social connections. This is a skill set that we absolutely have to teach our parents. Absolutely, if they don't already understand the power of what it looks like, what it feels like, and how it is they need to help bring it to the table. The next one, the third one, concrete support in times of need. This one just really talks about parents' abilities to really meet the basic needs for their kids. Do they know what those needs are? Do they even know how to go and get those needs satisfied? So it really not talks about not only do I know what my family needs, but also what are those resources and how is it that I go about gaining those resources? So sometimes we as providers, we are critical and key in bringing that information to the table for our parents. I worked for Healthy Start Coalition at some point, and I did some contracting for them. And one of the things I can say, part of what they did, they had a limited scope in terms of the product and service that they brought to the table. But one of the powerful things, what they had this incredible list of community and state resources. It was almost like you called they had a place called the Family Place. You called their Family Place and said, I need this and this, and you didn't even have to be a Healthy Start family at that point. You could just be anybody could call the Family Place, and if they had a resource, they would connect you with it. They would give you the information. So powerful, because so many of our parents and people that are in need, they don't have an idea of necessarily sometimes what they need, and then sometimes really not even how to go about getting it. So just to have somebody to have that conversation with, to help them identify what those needs look like and feel like, and how do they get connected. And in the midst of COVID, this is really taking on a new look, because now we have families that have never before had to, use the system. And now for the first time, they're saying, oh my God, I don't even know what I need, much less how I need to go about and get it. So us being able to bring those resources, to have those conversations with them, to help them figure out, perhaps this is what you really need. This is how we can link you to resources. And if not, you can just go to, 211. There's all these different places where hopefully we can help our families in terms of getting those needs met. Because if you have a product or service, if even if you're bringing one of those needs to the table, if they have all these other needs that are more critical than yours, if I'm worried about how I'm going to feed my family today, am I going to have light and gas today? Am I going to have a place for my family to live? And you might be offering something that's not quite as important to that. I'm not sure how much attention you're going to get. So it really behooves us to make sure that when they have those critical needs that are priority needs, that somehow if we're able to help them get those needs met, that will help us to be able to bring what we need and we think they need to the table. The next one talks about parenting of child development. Parenting and child development. So this is a two-parter. So this protective factor really talks about, the first one is knowledge of parenting. What are the skill sets that we need in order to be what I call, good and productive parents? And it really talks about, there's this concept between being a parent is part natural, which is kind of like the personality that we're born with, versus the part learned. How do we learn how to become parents? Our parents, the way we were parenting normally is the very first thing. But then if you're like me, you took parts of that and said, I don't want that. I want to keep a couple pieces, but I need to find some other pieces. And, I was blessed that I always had girlfriends that had, parents that I thought really had it going on. They really taught me things that I needed to know about becoming a parent when I became a parent, or even before I became a parent. So we talk a lot about that. The next part really talks about this whole idea behind child development. That's where we really talk about what those ages and stages. We talk about developmental milestones. We talk about the importance of parents, understanding what those are, how it is they need to bring themselves to the table to make sure they bring a supportive environment for their children to be able to meet those milestones or to bypass those milestones. And if there's something wrong, that there's a red flag or a yellow flag that says, maybe my child should be doing this, but they can't, how it is they can go about and seek some help in terms of identifying, is there a deficit here? And if there is a deficit, who are the resources that I could possibly go to get, this deficit addressed? So parents, I did not know about developmental milestones and ages and stages when my kids were coming up. I just kind of knew because people would tell me, girl, that child should be able to do this, this, and this. And, and I just had some wonderful people in my life. So that was kind of how I learned. And I learned about all of this once again, when 2012, when I came to work for Healthy Start, that's when I really, embraced this body of work. So that's when I got my first, oh my gosh, I love this work in case you can't tell. But that's when I first got my introduction to the whole idea of, once again, these protective factors. I think I was on the job like 3 or 4 months, and I went to the training. The last one talks about social and emotional competence of children. And this one really talks about the whole idea of our kids need three things. They need to understand their emotions in terms of how to identify them, how to experience them, and how to self-regulate. And they need to understand the power of how it is they need to be able to communicate. And then the third thing is really how it is they need to understand the idea of having healthy peer and adult relationships. So when we talk about social and emotional competence, it is about feelings and emotions. It is about communication skills, and it is about relationships, healthy relationships. So that's what we talk about when we talk about social and emotional competence of children. Okay, so we're just about finished. So, excuse me. So when we talk about, I want to go back to once again, because these protective factors are really focused on what? Children between the ages of 0 and 5, and equipping their parents to understand what this looks like and feels like and how it is they need to bring themselves to the table. So it says the early years are the most important period of physical, cognitive, and emotional development, all which play a vital and important role in our children's ability to learn, grow, and to thrive. Every interaction and experience plays a part in our children's current and future development. What did we talk about? The environment shapes our brain, the development of our children's brain. Even though you can have a child that's experienced a whole lot of adversity, you start changing that shift. You start giving them different kinds of experiences. You can rewire that brain, and it's a new day in Dodge, is what I say. So the last one and the most important, what it says, your actions and commitments can make a difference in the life of a child, their family, their friends, their community, and generations to come. You are the power of one, and you can change the life of a child. And when you do, you're impacting all those other people and all those other possible relationships that child has. This is a wonderful quote I absolutely love. It says, what? The world is before you, and you need not take it or leave it as it was when you came in. So I feel like each of you really lives by this, because just because of the families that you serve, that they will not be the same, and this will not be the same world, just because of your commitment to your families and to this work. So this is a resource slide. It talks about where you can go to get more information on the Strength and Families curriculum. It has information on the research, the resources, lots of articles, and it also has information on the Strength and Families, which is, remember I told you there's three. There's Strength and Families Protective Factors, there's the Youth Thrive, and then there's Families Thrive. So those are the three different curriculums that the CSSP offers. Okay, so these are some fact sheets for each one of those protective factors. There's a fact sheet they used to be located on the University of Florida IFAS website. They're no longer there, but if you want them, if you send me your email address, I will send them to you. And they have a really nice write-up about each one of the protective factors. Really nice resource. Okay, this is just some more information in terms of if you want to get some additional information about ACES. Okay. And this is my contact information. So I'm going to leave that on the screen. So we have a little bit of time if anybody wants to ask any questions. So do we have any questions? I went fast specifically so we could have time for questions. So Chris, if people want to ask questions, can they ask questions now?
They sure can. I've unmuted everyone, so they ought to be able to just unmute themselves and ask you anything they need to.
Okay.
I have a question. Would you know if in our pediatricians' offices we could request an ACE study or
An ACES screening. I don't know specifically. Yeah. Okay. And I don't know specifically if there's any in this particular area that are actually doing that ACES screening. It's my understanding that there's a specific ACES screening. It's not these 10 questions. I think there's one developed for like pediatricians. So you would have to actually call your pediatrician but I don't know of any specifically personally that are implementing this. So Dr. Burke, she's a Surgeon General in California. So since she went in that position, They got a grant for like millions of dollars where they are training all of their pediatricians how to do the screen. So she said, when one of her talks, she said, one of the issues with these pediatricians are, oh my God, if I do the screen, I don't know who I can refer them to necessarily, to fix all these things that are wrong with them. Well, she says, which I understand that, but first of all, you do need to understand what this screen can mean, how it is could possibly impact your child. She said, but then there's some basic things she said that all of us can even talk about, but specifically pediatricians. She talked about the fact that you can teach them about nutrition, that you can teach them about, she talked about healthy eating. She talked about, getting some rest. She talked about the power of mindfulness. So there were some things that she talked about. These are not things that, you have to have an MD to do these things. She's saying there's some things that you can do and that we can do um, to address some of these that are not necessarily clinical. But once again, if a pediatrician who is trained, to me, they would know if the women there, I think there's something really going on with this child, then I would think that they would have a relationship, or they would have some sort of a resource list to say, these are some, mental health providers that, I can connect you with. I would hope that pediatricians would have that. But I don't know personally of any pediatricians necessarily in this area that are doing them. I know there's one in Orlando. Her name is, what is her name? Dr. Candace Jones, I think, and she is like a big proponent of this ACES thing. It's almost like she's trying to be like the Dr. Nadine Burke in California. She's trying to do it like in that area, and she's a part of the ACES network. So she is really, a big proponent of it. But I would actually call and ask if you have a pediatrician to say, do you do the ACES screen? And if you don't, do you know any other pediatricians that do it? I think that's an excellent question
Thank you.
because it is powerful. Okay, thank you for your question.
Maria, great presentation. Thank you for that. I do want to add that Baycare Medical Group in Tampa does have some similar screening questions.
Okay. Okay, so do your pediatricians then actually use them? You have something similar?
Correct. I've had several visits, and each time they definitely ask the child about in terms of their eating habits, what they ate, how they slept, and different type of questions. There are 5 essential ones. I don't have verbatim, but I wondered why, although it makes sense, right? But they definitely connected the ACEs with those screening questions.
Mm-hmm, mm-hmm. But I guess what amazes me is that even though the ACEs came out of the medical field, it was kind of like once it started getting rolled out, you would have thought, just like Dr. Burke, she said, oh my God, when I learned about it, she said it like completely changed my whole concept of, she said my life changed in that moment. The purpose of my life changed because it was like, she said, I threw all this stuff out the window that didn't make any sense anymore because this was new learning and it made perfect sense. And she says, and I don't understand why the medical, people have not embraced it. She said that in her thing. She says, I'm still at it. I'm just mystified. How come they, of all people, this is science? She says, it's not even like we're trying to tell them something that's not science. It's been proven by the science, but it's almost like they're the last people that want to come on board, which really makes no sense if you think about it. Go ahead.
No, I just want to share in terms of from profitability standard, it makes total sense, right? The more people you get in, expedite them out, you could build.
But you look at, the cost of what it is, prevention, in this country, I don't know if we'll ever get to the point where we understand you pay 1 cent before it happens or you pay $200 after it happens. Until we have a change in a change in our mindset that prevention costs so much less money than, at the end of the game when everything is screwed up and you got to try to fix it. Nothing is going to change until we have a shift in that mindset because we need to focus on prevention. You know what I'm saying? Okay. I'm on my soapbox now. But
No, I definitely get it.
You get it, don't you?
Yes, ma'am, but big money. Everyone's getting paid along the way. Unfortunately, it's not about the child's individual well-being or health. It's about billable hours for most. I'm not saying all, but for most.
And that's so sad. That's so sad. But I guess what I don't understand is why is it that you could not have as many of those billable hours in terms of prevention versus once it gets broken? Because if you did it for prevention, to me, you seem like you'd be able to help so many more people who don't end up having to take advantage of your services. So I don't understand why, and maybe because I'm not in the medical field and I don't understand the billing thing, but I do understand people want to get paid and it's big bucks in healthcare. I mean, I totally understand that. But if somebody said, okay, all of a sudden now, we're going to start paying for all these preventive services. We're going to have new DSMs or whatever you need to do in order to get these people paid. You know what I'm saying? That would be the shift. Because if you want to get paid, you just need to tell me what does that look like and feel like when I move from prevention versus, it's already done, said and done, and you're trying to fix the brokenness. Okay, that's why I'm not a politician or any of those other things. Because, okay. So does anybody else have any other questions? Great question. Are there any other questions? Okay, well, if not, if there's any other information that I can possibly, provide to you, all you have to do is, once again, you have my email and you have my phone number. And if you could send me an email, not put it in the chat, I need you to send it, actually just send me an email right now to say this is additional information or whatever it is that you need. I promise you, I will respond to you. And I'm not sure how you're supposed to get a copy of the presentation. I did forward it over and they said that it was going to be available. So Chris, can you tell me, is it available and how they can get a copy if they want?
I think the organizer is going to send out a link for that.
It's also on the document section of the website. I put the link on the chat if anyone wants to look at.
Fantastic. There's also a quick survey listed in the chat. I want to thank Maria and I want to thank everybody that attended today. If you could do the survey, we appreciate it. You can go back to the UVA platform and see the sponsors' profiles, the virtual exhibitor hall, and we hope you enjoyed the 2021 Health and Human Services Summit and appreciate everybody coming.
And I want to thank you all. I want to thank Chris for his support. And please, we really do need you to fill out the survey, okay, so that I can get some feedback. And once again, thank you all for attending, and I hope that this was worth your 2 hours. Everybody be blessed.
Fantastic. Thank you.
Okay, bye-bye.
Bye.